I'm Nkateko Nkhondo. I'm a medical doctor, a public health specialist, and I've been working in WHO for 7 years. Outside of work, I am a daughter, I'm a sister, I'm a very proud aunt, and I'm a runner. Yeah. I think, initially when we heard of cases coming up in other countries, it felt a bit distant. It's not even on the continent, but numbers really started increasing quite quickly. And we started to get worried. And I think for me, the biggest concern was the mortality. There was a lot of deaths, and you're now hearing reports from other countries, and immediately your mind wonders how we as a country would deal with this if it came here. Are we ready? What about our hospitals? What about, do we have enough ICUs? If countries that are well advanced do not have enough ICU beds, what about us? How are we going to cope? So I think it was a very scary thought, and I remember the day very well when the first case was announced. We were having several meetings in the country office just to prepare for worst case scenario. And we had thought about it, that if we got cases and we knew what was coming, what would happen? And without a bat of an eyelid, my colleagues and I were like, we would need to go help. We definitely can't sit here comfortable while the country's in crisis. And so when that moment came, we had already put our hands up before. And I was deployed to Kwazulu Natal, where the first case had been, and where quite naturally numbers were increasing by then quite exponentially. And I remember when we arrived in KZN, we checked into a hotel. The next day, lockdown started, and the hotels were kicking us out. So you want to be there to support and to help, but now you're having to figure out. I remember we just checked out, we took our bags, we went to the provincial office for a meeting, and we were not sure we were sleeping that night. So in my team, I had the late Dr. Patrick Hazangwe. He had been working with us. I had Tula Sizwe, the data manager. There was Ntabi Singh. And basically we were a team of 4, and we always had a driver with us. And we were all staying in one B&B, so we became a family to each other. And I remember the support that I received even from the team. We're all in the same place, and you sort of become like each other's family. I mean, you can only shop at certain times, so you shop together, you go to work together. We pretty much did everything together. And so during that period, during the first wave, I lost a very close family member, and it was difficult because I'm away from my family, and because she had been very ill, I'm getting calls. It's like, it was a frustrating situation. And eventually I spoke to one of the doctors, and they were like, I think you need to come back. So I spoke to the WR, and he immediately was like, please, So they got a driver to take me sort of halfway and another driver to meet me on the way. Unfortunately the next day, she passed away. It was a very difficult time, but the support from the new family in KZN that we're now all living together had been so amazing. The support from the office, and it's loss during COVID was very difficult, because remember, even the funerals, they were very, almost want to say, inhumane. There was so much against the cultural norm that we were used to. The numbers had to be little. You couldn't have too many people in the house. It was just, the experience was, it was a very terrible experience. Little did I know that thereafter I would go on to lose other friends, other colleagues, other close people. And I think we felt like we had symptoms almost every day. Every scratch made you worry, every cough, anything that you felt that was out of the norm made you worry, and you were wondering, maybe I should go test. Sometimes you would go test and you're fine. It's like you were constantly on your toes. It was very stressful. It like that entire time had this constant undertone of stress. I don't think any of us were in a mentally well space. We would go to hospitals to check for readiness, and I think I know KZN like the back of my hand now. We've been to every district, almost every corner, and every time, even when you visit a hospital, or if you are interacting with healthcare workers or in a place where there's patients, there's that constant worry, that constant concern. And then thereafter, you're gonna have a scratchy throat and you're gonna wonder, oh, did I pick something up? So I think I would say different kinds of exposure created different kinds of paranoia. I'd put it that way. Yeah.